basically where this is the Treasury Intergenerational Report 2023. Basically, the healthcare cost in Australia by 2026 is going to from $3,000 per person to $9,000 per person. So they know that it's unsustainable. Everywhere, everybody knows that it's unsustainable unless we change our way of practicing medicine. Look, I don't have time, to go into the details, but, right now we have been just talking about basically metabolic health, body health, but in reality, there is many other important concepts that, we are not really working on in our modern medicine. That is, sleep. Sleep is extremely important for health. We know, if you are not sleeping well, you have an increased risk of dementia, obesity, hypertension. There are, breathing techniques that are very important, meditation, mindfulness, and there are a range of emotional activities and art, spirituality, altruism, compassion that are influencing our inflammatory immune function, our well-being. Remember, what you do every day becomes you, because if you repeat something, you create some synapses in your brain that reinforce this type of. If I play piano for many years, I'm able to play piano without thinking about it. If I spend most of my time to be happy and try to be positive, I'm going to reinforce those synapses in my brain. Instead of, if I'm depressed, I'm always negative, I'm always angry, I'm always sad. I'm reinforcing those type of synapses, and that's become me. So think about it, and I think, we should really change our healthcare system because it's unsustainable. I'll give you some numbers here, okay? In my country, Italy, we are already 25% of Italians older than 65, predicted 34% in 2050. In 2050, 1/3 of Italians are going to be older than 65, okay? And based on data we published, basically 65% of these people older than 65, they have 2 or more chronic diseases. So the national free healthcare system of Italy, as it is unsustainable. You can make your math. If you have 1/3 of Italians older than 65, they're unhealthy, who is going to work, to pay welfare and healthcare is impossible. These are data just published in Australia, basically where this is the Treasury Intergenerational Report 2023. Basically, the healthcare cost in Australia by 2026 is going to triple from $3,000 per person to $9,000 per person. So they know that it's unsustainable. Everywhere, everybody knows that it's unsustainable unless we change our way of practicing medicine. So again, as I said, this is just to show, that, the population, people are getting older. I think in Korea, it was in 2010, 11% of people older than 65. In 2050, it's going to be 34% of Korean older than 65. Okay? And the other major problem that is happening everywhere is the epidemic of obesity and overweight. Not only in adults, but these are in children. Everywhere, the number of overweight children and teenagers is growing. In Australia, I don't know in Korea, but in Australia, 25% of kids are overweight or obese, and 40% of teenagers that are overweight or obese, and 66% of adults are overweight or obese. Okay? So this is a study published in New England. It's the most important journal. So obesity is strongly related with type 2 diabetes. So in this study, basically, they follow people, young people with diabetes. So when they were 20 years old, they had type 2 diabetes. After 11 years, when they were 39 years old, 67% of them had hypertension, 50% diabetic nephropathy. So these people, eventually, they're going to have dialysis of kidney transplantation, 50% diabetic retinopathy, and 30% diabetic neuropathy. Impossible. It's going to be impossible to pay for all these people with, 40, 50 years old, with all these complications. Who's going to pay for it? And by the way, these are preventable diseases. So not only primary prevention, this is a study, a randomized clinical trial published in Lancet Diabetes. So they took basically people with type 2 diabetes, and as you can see here, those that lost more than 15 kilos in 1 year, 86% of them, no diabetes. They were in remission. They were not taking medication anymore. They were free of diabetes with just weight loss, exercise, and diet. 86% free of diabetes in 1 year, okay? So here we are talking about lifestyle interventions that are so powerful in preventing or treating chronic disease that is, I cannot understand why we are not investing. And by the way, what we are finding with this biology of aging research is that many of the common chronic diseases that we see in our hospital, they share a common metabolic substrate. Cancer and dementia and heart disease and fatty liver disease and diabetic nephropathy are basically one disease. Of course, if I have cancer, if I have breast cancer, I want to be treated by the best breast oncologist or breast surgeon. Makes sense, I'm not going to ask, a cardiologist to treat my cancer. But the concept is that if we work upstream by changing in green all these lifestyle factors, we are influencing, as I try to show you, multiple metabolic factors, and therefore we are preventing multiple diseases at once, okay?